Well, today we commence here in our state the rollout of vaccinations for our 5 to 11-year-olds, and that will occur in GPs, pharmacists, and many of our hubs right across our state. As a parent, I know it can be daunting getting your children vaccinated. We had our daughter just last week being vaccinated, who's in preschool, and I think she screamed the GP centre down. But what I know here with our hubs that we're supporting that GP network here in New South Wales is that it's a very kid-friendly environment, highly supportive to ensure there's as much comfort for parents, anxious parents and children as we go through this period. But
today we have around 2,030 COVID cases admitted to hospital, with 150 people in intensive care, 47 of whom require ventilation. There were 20,030 cases detected by PCR testing reported in New South Wales to the 24 hours to 8 p.m. last night, and 84,000 PCR tests were reported in that period. Now that clearly is an underestimate as people are moving and transitioning to RAT testing, the rapid antigen testing. One of the key issues, we just want people to be linked with care. So if you fall into the categories where you're unvaccinated, you're pregnant, you have chronic underlying medical conditions, please don't delay getting a COVID diagnosis. It is critical that you are linked with care. And also, please, a reminder, do not take symptoms such as breathlessness, particularly in young people when that is not your underlying usual condition, without taking that very seriously. And I think you've heard before from some of our intensivists and respiratory physicians that we don't expect young people to get breathless or dizzy, and that's a sign that you really need to escalate your care.